Hi ma'am, I'm Sneha. I'm doing my second year MBBS and I have a doubt. For the past 6 to 7 years I've been using specs. So what's your opinion on laser treatment?
Laser treatment is something which is in vogue nowadays. People are having so many doubts about that, because earlier when somebody was diagnosed to have some short sight or long sight, the only option they had was to use spectacles. They had no other option. But as innovations came contact lenses, so which were to those who were very conscious cosmetically about wearing spectacles. Some professions demand the use of it, so contact lens became trendy. Then the problem with contact lens, like the problem or inconvenience rather, that is the correct word, with contact lens was that it is very tedious to use it regularly. You have to be very careful, otherwise you will get an infection of the eye. So again, people got tired with that, and now they want a better option. They cannot use spectacles, they cannot use contact lens, they want something else. And then came refractive surgeries, that is in short what people know as LASIK. It is actually, you are modifying the curvature of the cornea. Cornea is an important medium through which the light rays pass through. You know that when we look at the eye, there is a very clear transparent area that is called the cornea. And about, a major contribution to the total power of the eye is by the cornea. So any change in its curvature or shape can affect the power drastically. So what we do in LASIK is, we apply a particular frequency laser to the cornea so that some fibers are they get flattened, or they get the texture get abnormal, so that we get a necessary steepening or flattening depending upon how we apply, depending upon how much depth we apply. Like that we get a flattening or steepening of the cornea. So that is what we do in LASIK. But is it advisable to all people who is having refractive error? That is the question. So there are certain prerequisites or conditions that has to be satisfied before moving in for a LASIK. One thing is, you should be more than 18 years of age. Usually in adults, we don't do it in children. Then your refractive status, that is the power of your eye, should remain stable at least for 1 year. That is, in between, if it is changing, if it is 0.5 this month, after 6 months maybe it is 0.75 plus 1 or like that. If it is keeping on changing, then again it is not an ideal situation. It should be remaining stable for 1 year. And there are certain evaluations like how much thick is your cornea, is the shape perfectly okay, otherwise your eye is normal, your retina is good, your lens is clear, everything else is absolutely okay. Then you can think of a refractive surgery, especially for people who need higher powers, because the thickness of the glass is again causing much of the cosmetic blemish. If it is a very stylish thin glass, I don't think people would mind wearing that. So if that is also a problem, and in certain situations even contact lens may not be suitable for your work, like especially if you are very busy, you don't get enough time to give much attention to those things. Then also, and spectacles, if you are a dancer or if you are a sports person, then maintaining a spectacle is very difficult because it will restrict your mobility. So in such situations, of course, LASIK surgery is a very good option. It has got its own advantages, and the side effects or the complications that may occur is very minimal as far as studies till now. So the first thing or the good thing that you should do is, you should find out a good ophthalmologist with whom you can discuss all these problems, your requirements, your inconveniences, and then get to a decision rather than going in for the trend or following others. You should have an idea about your problem and then come to a conclusion whether you should go for a LASIK treatment or not.